I spent over 18 months coordinating my late husband's care across 10 doctors. You know what shocked me the most? Not one healthcare platform, practice, whatever, ever explained why we should keep logging into their portal after that first appointment. Guess what? Your enterprise buyers are noticing the same gap in your demos. They're asking 3 questions you're not answering, and it's costing you deals. Want to know what they are? I'm Doree, and I help patient engagement platforms win enterprise deals by fixing the gap between what health tech companies build and what patients and buyers actually need. In the next 6 minutes, I'll reveal the 3 questions every hospital CFO, CMO, and IT director ask themselves during your sales cycle that your content, your demos, and your case studies completely ignore. By the end of this video, you'll know exactly how to address these questions so you can differentiate on patient experience instead of just competing on price. Question 1. Will this actually reduce our support burden or just create a new one? Here's the thing nobody talks about. When a hospital or clinic evaluates your patient engagement platform, they're not just thinking about whether or not patients will use it. They're thinking about what happens when patients don't understand it. Because every confused patient becomes a phone call. Every confusing interface becomes a help desk ticket. And every unclear message turns into a scenario where a nurse is spending 15 minutes or more walking someone through something that should have been intuitive. Your buyers have been through this before. They purchased easy-to-use platforms that created more work, not less. So when they're sitting in your demo, they're not just evaluating features. They're mentally calculating, how many support calls will this generate? Your content probably isn't answering that question. Instead of just showing that your platform has a patient portal with messaging and appointment scheduling, you need to show how you've reduced the comprehension gap. Walk them through your patient engagement strategy. Show them the in-app guidance, the plain language explanations, and the contextual help that appears exactly where patients need it. Better yet, show them the data. After implementing our comprehension-first onboarding, our clients saw a 40% reduction in support calls in the first 90 days. That's a proof point that makes a CFO lean forward in their chair, because you're proving that you understand their operational reality. How will we prove ROI to our board when patient experience is hard to quantify? This is the elephant in the boardroom. Patient experience is important. Everyone agrees on that, right? But when your buyer has to justify a 6-figure purchase to their board or their CFO, better patient experience doesn't cut it. They need numbers, they need business impact, and they need to connect your solution to metrics their leadership actually cares about and tracks. Patient retention rates, no-show reductions, time to payment, net promoter scores, NPS, or even downstream revenue from improved patient loyalty. The problem is, most health tech companies talk about features and benefits, but they don't connect the dots to the financial outcomes that matter in the boardroom. So your buyer's sitting there thinking, okay, this looks great, but how do I defend this to my CFO? And if your content doesn't answer that question, you're making their job a lot harder. So what should you do instead? 1. Build an ROI calculator into your sales process. 2. Create case studies that don't just say, patients loved it. Show how a 15% reduction in no-shows translated to $300K in recovered revenue annually. 3. Interview clients and ask them specifically what metrics improved and how they presented those results internally. Then make that content easy to find. 4. Put it in your demo deck. And 5. Feature it in your sales enablement materials. By the way, I'm not just a health tech consultant, I'm also a sales enablement copywriter, certified, and ready to help. When your champion can walk into that boardroom and say, this platform will reduce our no-show rate by 15%, which equals $300K in annual revenue recovery, that is when your budget will get approved. You're not just selling a product anymore. You're providing the ammunition that your buyer needs to win their internal battle. What happens when our providers resist adoption? Oh, that is the question, is it not? You can have the most beautifully designed patient engagement platform in the world, but if the doctors and nurses won't use it, it dies. And healthcare buyers know this. They've watched expensive software purchases gather dust because clinical staff staged a quiet rebellion. Maybe it was because the system was too complicated. Maybe it added extra steps to their already overwhelming workflow. And maybe, just maybe, nobody explained in a way that they care about why it matters. Regardless of whatever the reason is, provider resistance is the silent deal killer. When your buyer is evaluating your platform, they're thinking, How am I going to get Dr. Martinez to actually use this? She's still using a pager and paper charts. What's missing from most health tech marketing is the real acknowledgement that provider adoption is a real challenge and a clear path for overcoming it. So instead of pretending this isn't a real issue, lean into it. First, what you want to do is show your buyer exactly how you design for provider adoption. 2, talk about your training approach. Is it a boring 2-hour webinar, or is it a bite-sized, role-specific video that a busy physician can watch in 5 minutes between patients? 3, show them how you've reduced clicks and streamlined workflows so that using your platform actually saves them time instead of adding to it. 4, share testimonials from skeptical providers who became champions. The golden nugget is if you give them a change management toolkit. Provide templates for the announcement email, talking points for department meetings, and quick win strategies for the first 30 days. Showing your buyer that you've thought through provider adoption as deeply as you've thought through product features makes you more than a vendor to them. You've now become a strategic partner who understands the real challenge of healthcare transformation. All right, this was a short video, but I'm still going to do a quick recap. The 3 questions your healthcare providers are secretly asking themselves are: 1, will this reduce our support burden or create a new one? 2, how will we prove ROI when patient experience is hard to quantify? And 3, what happens when our providers resist adoption? If your content, your demos, and your case studies aren't directly addressing these 3 questions, you're leaving money on the table and making it harder for your champions to close the deal. So here's my challenge to you. Take your current sales deck or your website homepage and ask yourself, do we answer these 3 questions clearly and with evidence? If not, that should be your next project. And speaking of projects, if you want to do a deep dive into how well your current content is actually serving your sales team, I've created a free resource called the 5-Day Sales Enablement Content Audit for Health Tech Startups. I've linked that in the description. Now, watch one of these videos next.